So please have an open mind so that you don't die while bringing life into this world, or let the life you have incubated for this period of 9 to 10 months die just because of customary, religious, or societal stigma. Welcome back to the Gym Network. I am Okay God. Quickly give this video a thumbs up because it goes a long way to help this channel and the video to be seen by a lot of people. And now that you have done that, please, if you have not subscribed, go ahead to subscribe. So in today's video, I'll be sharing with you the things you ought to know about cesarean delivery, commonly known as what? CS section. So we'll quickly dive into the video. One of the questions is, what is the common incision or scar for CS section? Okay, a CS section includes an abdominal incision and a uterine incision. After the abdominal incision, the doctor will make an incision in your uterus. That's the lower transverse incision. They are the most common kind of incision, and these incisions are always made at the top left part of the abdominal. So that is it. What are the types of C-section incision? There are two major types of C-section incision. Number one is the vertical incision, and the second one is the horizontal incision. Both incisions are equal and likely to scar, as in to give you a scar. Yes, but the scar will look different depending on its direction. On the other hand, horizontal incisions are more common in planned C-section. So those are the two major types of what? CS incision. What should my C-section incision look like? This is one of the questions that a lot of people ask. So from finding, they say since they are usually made below the pubic hairline, otherwise known as the bikini line, so you may likely not be able to see it. You can't see the scar. It will look red or pink at the beginning for several weeks or months, but eventually it fades to a pale, flat, thin line. Some women create bigger incision that they are thick and raised scars than others. However, they are rarely obvious. So if you are afraid of that, your incision are really what? Obvious. It goes from red to pink at that early stage, but with time, it goes down. You can barely see it. What causes C-section delivery? So some people have been thinking that if a woman is pregnant, she just opts for C-section. No. The cause of C-section delivery, doctors will perform cesarean delivery when the low-lying placenta partially or completely covers the cervix, otherwise known as what? Placenta previa. A cesarean delivery is necessary when the placenta also separates from the uterine lining. This one is known as placenta abruption. Placenta abruption. So this is one of the reasons why a cesarean delivery will be carried out on you. Which is better? Normal delivery or C-section delivery? So from finding, it says cesarean delivery is often safer than vaginal delivery. In case of the danger posed to the mother or baby due to a medical condition and reduce the death rate and illness in the mother and baby, delivery can be scheduled according to the convenience of the mother. That is one of the beautiful things about it. So you could choose to have your CS at 36 weeks, 37 weeks, 38 weeks at your own convenience. And you know, it is safer. Are C-sections painful? Okay, You won't feel any pain during the cesarean section, but you're likely to feel some sensations like pulling, a pulling sensation, and the pressure, when they are trying to pull the baby. That's what you may feel. Most women are awake all through the cesarean section. They are simply numbed from their waist down. So they are usually given what they call regional anesthesia, and or what they call spinal block. Yes, spinal block. During that C-section, they are awake to see how their baby is being brought and to receive their baby, and probably hear the first cry of their baby. That is one of the most important aspects of any delivery, to hear your baby cry and also to see and feel your baby. Okay, do C-section scars stay forever? C-section scars do not go away completely, but you can minimize their appearance with non-surgical and surgical methods. Yes, C-section scars do not go away completely. They can fade on their own with time or with treatment, but a visible line is often left. So the scar doesn't go away, but there is always what? A line that is being left. So it's not as heavy as what you are imagining or thinking it's going to be like. How big is the average scar? How big is the average C-section scar? So once it's healed, a typical cesarean scar is between 4 to 8 inches in size. However, this length can vary depending on the placement of the incision and the space required to deliver your baby. Over time, the redness will diminish and the scar should gradually fade, but often these scars are hidden by the pubic hair, so you don't need to worry. Do they cut the same scar for a second C-section? Of course, yes. It's just like asking, I'm pregnant with my second baby. Am I still going to deliver my vagina? Do you understand? If like for the persons that have had vaginal delivery, all of the children they have is through the same VJ. It's not as if another VJ was imported. If you understand what I mean. So yes, ideally your doctor will cut through the same scar so that you don't have multiple lines, multiple scars on your abdomen and uterus. Sometimes scar tissues can be difficult to cut through, but your doctor should be able to cut through it. So everything will still depend on your doctor, but ideally your C-section will be cut at the same point, except otherwise, which your doctor will now determine. So how many children can you give birth to via C-section? So most times they say three children, but I've heard of people that have 6 children via C-section, and I know you don't want to have 6 children. So whatever it is, just adhere to your doctor's instructions. So it's better when it's been discussed, because every individual body varies. So it is dependent upon your body and your physician. So your physician knows how your body works. So they will know if you are going to go more than 3 times or even less than 3 times. But the maximum I learned anybody can have is 3 children. But you can have more than that. So with this, I hope I have given you the basic information you need to know about a C-section. So please have an open mind so that you don't die while bringing life into this world, or let the life you have incubated for this period of 9 to 10 months die just because of customary, religious, or societal stigma. See you.